Thank you for joining me. This is the Bold Lines podcast, and I am your host, Travis Thompson. Today we're going to be talking about when to blame the person or the disorder for the problem. Let's go ahead and get some things out of the way. Yes, this is going to be somewhat of a frustrating or inflammatory thing, depending on which end you find yourself by the conclusion of this episode, but I do want to let everyone know that's listening that what I'm going to give you shouldn't be used as a way to attack a partner or even yourself. Being able to sort through whether an issue is from someone's personal responsibility or lack thereof, or if it's from a mental health disorder that could use some support or treatment is a huge deal. I mean, many things that I see in therapy seem to be a mix, and I can understand that. However, if one camouflages as the other, if there's a personal responsibility issue camouflaging as a mental health issue, or if there's a mental health issue camouflaging as a personal responsibility issue, then the things that we would use to help, the techniques or the support or the challenging, would be largely ineffective. We need to be able to tell the difference between what is a real need that someone has and what is an excuse for poor behavior. Obviously, what I'm going to be talking about today isn't going to be 100% accurate in all cases. What I'll talk about is a very overall understanding of the difference between the two, and you can sort out for yourself where you land or maybe take some guesses how someone you care about lands in all of this. So, let me tell you about some things that I have seen in therapy that will help us sort this out. Number one, let's go to mental health. It's a very, very hot topic nowadays. And for all of the people coming in talking about their mental health, I've started to find that most people don't actually know what mental health is and what diagnoses really are. So people will come in and say, I have anxiety, or I have depression. I have ADD or ADHD, or I've experienced trauma and have PTSD. And that might all be well and good. But many times, the people that come into therapy have bad information they're working off of. This bad information might be around what a diagnosis is and what characterizes it. What are some of the symptoms that are common and the ones that are maybe not so common? One of the big things that I see a lot of bad information from is just the lack of it. Many people will come into therapy and assume that they wholeheartedly understand a diagnosis, when in reality, they might not be able to tell the difference between two diagnoses that can present in a very similar way. And so people can have this idea of themselves. They can conceptualize their experience through bad information and treat themselves in an incorrect or an unhelpful way. One of the other things that I've seen in therapy is that while someone might have an accurate understanding of what a diagnosis is, they might misunderstand how it applies. This is really easily seen in something like ADD or ADHD. ADD and ADHD is a problem in executive functioning. It's where the brain is able to make decisions, how it stays focused and resolves immediate tasks. Although I've had many clients come into my office and say, well, because of my ADHD, I'm really anxious. Okay, see, those are two different things. You can be anxious because of focus issues or losing out on things, but one doesn't necessitate the other. You can have an anxiety disorder and ADHD, but if you simply assume that the anxiety comes from the ADHD, well, there's a problem. Because someone can have ADHD and zero anxiety. I mean, that might be because they don't care, or it might be just because they found a way to resolve everything. So those are some of the big things. Let me give you a large framework for what happens next and what we're going to be talking about. This is one of the lines that people hear in therapy and hold on to, and I'm hoping in this podcast it can be much of the same. So I'll have clients come in and they'll say, well, I think I'm not following through because I'm just lazy. I just can't do the things that you tell me to do. Or I know family members and all these other people are expecting this of me, but I'm just too dumb or too lazy to follow it through. And okay, that can very well be an issue. On the other end, sometimes people come in and complain about how their mental health is affecting them, or the way that their symptoms or medications are impacting their ability to function. This is absolutely seen in more severe things like addiction or personality disorders or some of the higher level mental health issues. Now, here's the line. Please don't use this as a bludgeon. Please don't use this as a way to force someone's behavior. It's not going to be 100% accurate in all cases. All right, here it goes. If someone says their laziness is keeping them from doing something, then they probably have a mental health issue. If someone says their mental health is keeping them from doing something, they are probably just lazy. I'm going to let that simmer for just a second. If someone says their laziness is keeping them, they probably have a mental health problem. But if someone's complaining about their mental health, they're probably lazy. I know this isn't quite the most in vogue thing to say, especially as a therapist. We're supposed to affirm and support everybody, and no matter what they're feeling or thinking. If someone tells you that they're anxious, well, we have to affirm and tell them that, well, it's okay. This is anxiety and this is how it works. I don't think that's super helpful. While I wouldn't ever want to shame a client for saying that they feel anxious, there comes a point in therapy, and I've started to be able to identify this in sessions and even inside myself, that sometimes the excuse gets old and it doesn't really follow anymore. That when someone comes and says, well, man, my bipolar is just really keeping me from being productive. Is it? Because you've had the diagnosis for 5 years. You've had the opportunity for medication for the past 3. When exactly do you have to do something? Again, please don't use this as a bludgeon, but there's certainly an important point here. Many people who struggle with mental health issues need help, and that's totally fine. But loved ones around this person, the ones that are knowledgeable about mental health, sometimes they can hear those excuses and recoil. I would argue that there's probably a good reason for it. Now, this might light a fire under a whole bunch of different people and scenarios, and that's entirely fine. I'm completely okay with that. However, what I'm not okay with is having this whole population of people, and I'm speaking about this in a very large, amorphous way, but I'm not okay having a large amount of people who have been so conditioned to blame mental health that their personal responsibility has gone out the window. Are all of these people selfish? Probably not. Some people have just been given this idea of learned helplessness. After failing over and over and over, they come to believe that they can't succeed. This is a really common thing that's seen in mental health, but also physical, and even training animals. If you want to look up learned helplessness, you can see it with animals like horses, where you teach them that they're chained and you can actually lower the amount of resistance that's needed. And so a gigantic horse can actually be held still by a thin rope and a table chair because they've learned over time that there's no point in bucking back. The same thing can happen with people, where over time there are large fights and the ways that they've pushed against their issues haven't worked. And so slowly over time, they've started to fight less and less. That's the most charitable version of all of this, that some people who express issues with mental health have just learned, quote unquote, that they're not capable. On the other hand, there are plenty of people who complain about mental health issues when everyone else around them realizes that they just don't want accountability. Now, this probably isn't the mass amount of people that struggle with mental health. I would argue that this could just be a loud minority, but it's certainly there. where people complain that their anxiety, their depression, their mood, whatever it is keeping them from achieving greatness, or maybe even just achieving mediocrity. Or if I were to even go below that, even just achieving what is required of every person on this earth. So are there people out there? Sure. The purpose of this episode isn't to beat them with the information that you hear today, but it is to equip people to say, mental health is a lot of personal responsibility. If I were to take something like bipolar disorder, and I were to approach someone with this disorder, I would likely say to them, it's not your fault that you got it, but it is your fault in what you decide to do with it. So you can have compassion, you can have direction, but personal responsibility is what drives the person forward. It's also what makes them healthier. If we're being entirely honest here, we can sit through symptoms all day, but if the person doesn't take personal accountability and responsibility for their actions and for their health, they're not going to get anywhere. Let's switch the dynamic. Let's go to the other side of this. I have a lot of clients that will complain that they're just being lazy. And in some cases, that's certainly true. But in a lot of the cases that I work with on a daily and weekly basis, the people who complain that they're just lazy and they can't seem to get things done have some sort of mental health issue that is unresolved. When I say mental health issue, I'm not saying that everyone who is incapable or feels at a loss has some sort of mental health disorder. That's not it at all. What I am saying is there's some aspect of their functioning, something about the way their brain works or the way they've been trained that just is holding them back. And so I break this down with clients. Okay, can you tell me why you think you're lazy? Well, I was watching Netflix for 12 hours. All right, okay, that one's on you. That's not a mental health issue. I mean, it could be a little fueled, but come on now. That's 100% your decision-making playing out. But in most cases, people will say, I just didn't feel motivated. I couldn't get myself to do it. I feel lost when I try to look at myself. See, those things are aspects of someone's experience that I can be curious and compassionate with. That when they complain about being lazy, really they just see themselves as less than. They feel unable to continue either because of some way that they've thought, some way they've been trained, or through some legitimate mental health diagnosis. And with those people, the ones who complain that they are lazy, for the most part, they're the ones most willing to hear feedback. Because most of the people who complain that they're lazy really just want to know how to handle things. They want support. They want guidance. And the moment that you give compassion and you offer support and direction, it seems that these people really do find flourishing and healing. That's of great support to anyone who's considering therapy. Maybe there are things that you do that are lazy, but maybe you actually have some issues that have been unaddressed. I would ask someone who might be in this camp to step back and look objectively. Compare your situation to the people around you. Do most people have these same issues? Do some people have these same issues? If it's this idea of being unable to self-reflect, is that a common thing? Or is it a small thing? Or is it just you? Maybe there's a pattern that you could fit into. Maybe there's other people who have experienced something similar. If it's clinically significant enough, we call that a diagnosis. It always matters what that diagnosis is, and goodness, who's going to decide to treat the thing. But if you have found yourself sitting here listening to this podcast and wondering, wait a minute, maybe I do have something screwy with my mental health. Maybe there's something going on that I need to look at. Congrats. This is a really great place to be. Because if we can look at this objectively, it becomes less about how much you suck, how lazy you are, or how worthless you seem to be, and more about what we can do next. A lot of this information I know is a lot. So let me go back to the line I said before to refresh your memory, and we can think about how this applies to us. Here's the line again for those that have forgotten, or maybe those that actually do have ADD or ADHD and have lost track. If someone says their laziness is keeping them from doing something, then it's probably a mental health issue. If someone says their mental health is keeping them from doing something, they are probably just lazy. So what do we do with this? Outside of a podcast, outside of a therapy session, as maybe you're on a drive somewhere, maybe you're considering your next steps, if you would maybe even go into therapy, examine yourself. Sit for a second and think through. When I fail at something, or when I don't take the chance, what is it that comes to mind? Do I blame myself for not trying? Do I blame myself for not keeping my mental health under control? Do I blame myself only because of the actions of others, all of these outside influences? If you blame yourself for failure, you might be somewhat accurate. You're also more likely to have some sort of mental health issue. On the other hand, if you're blaming everyone else and it's everybody else's problem and you can't seem to take responsibility, either a whole bunch of people are out to get you or you're the common denominator. You're the one that is in common with all of these things, and you need to deal with some personal responsibility issues. If you can truly examine yourself and you've found yourself along the continuum that I've described, I would ask you to consider how honest your responses are to others. Is the way that you speak to others the way that you think inside your head? When you confront yourself with your own misgivings or the things that you struggle with, do you say the same things out loud? Do you internally have turmoil about mental health issues, but when someone asks, you simply say you're lazy or you forgot? Or maybe it's the inverse, that internally you have this dialogue of, man, I really don't want to do this. This sounds awful. Why do I have to do this? And then someone comes up to you and says, hey, why haven't you done it? Oh, gosh, it's my anxiety. To the first one, have empathy and compassion. To the second, get a grip. No one knows you anything. It might sound harsh, but if you're at a point where you're making excuses for poor behavior, we can talk about mental health. In reality, this is something you need to address inside yourself, with support, obviously, but I can't help someone with mental health who isn't willing to look at themselves honestly and reasonably. So now that you've considered how honest your responses are with yourself and with others, make sure you know what a true mental health diagnosis is and what is simply a pattern or belief that you've picked up over time. I said earlier that some people have an understanding of mental health but have no idea how it works. Maybe that is you. Maybe some of the things that you've picked up have been a mirror from what you've seen in your own life or in the life of your family. It's certainly worth considering. Do you feel worthless because you have an anxiety disorder? Or do you feel worthless because it was taught to you to be worthless? Something to consider for therapy. Also, if there is a diagnosis, if there is something legitimate, something that is distressing and is unable to be changed or supported or pushed in a more positive way through personal responsibility and work, you might just have a mental health diagnosis. And if you do, that's fine. I think a lot of people could use a lot of support in exploring that. The one thing that I do hate, well, maybe hate's a strong word, but I'm going to go with it anyway because it's my podcast. The one thing I do hate is when people say, well, this is my diagnosis and it's also my superpower. Shut up. That's not how it works. Okay? Stop infantilizing people. If you have a diagnosis, it sucks. Could there be some positives? Sure, if you know how to work it, but overall, it's not your superpower. It sucks. Also, you don't have to be ashamed of it. Because chances are, if you have a diagnosis, other people do too. Diagnoses are brought upon us in the DSM and through other regulatory bodies through patterns. If you fit a diagnosis, there's probably a good amount of people that also fit it. You're not alone. Should you plaster it on a t-shirt or start a LinkedIn campaign about it? No, but you're not alone. I would encourage anyone to be open and honest, to learn what mental health really is, how to honestly care for it, and also where you can engage in personal responsibility. If you're unsure, look around you. What are the people around you saying? If they're all complaining about mental health, they might be lazy and you might be a part of it. If the people around you are all complaining about how lazy they are, they might have mental health issues and you might be a part of it as well. Nothing that I've said today is 100% accurate, and I preface this episode with it, but really think through this for yourself and for people around you. What is it that you usually are concerned of? It's probably the opposite. And in therapy, I see that pretty consistently in your own life, if you're honest. If you push everything out of the way and you consider what's going on, you might find a little direction. I'll say this line one more time before we close out, just in case you forgot. If someone says their laziness is keeping them from doing something, then it is probably a mental health issue. If someone says their mental health is keeping them from doing something, they are probably just lazy. Thank you for joining me. I hope you got something from this podcast that could be useful to you, something that can help you gain greater insight into yourself and those around you. If you feel the need, you can leave something as a tip to help pay for the production of this podcast. If not, I hope you subscribe to the podcast and share with others so that they can find hope and healing in their lives as well.